Hello and welcome. Today, we're diving deep into a rare and complex kidney condition called Xanthogranulomatous pyelonephritis, or XGP. This mouthful of a disease is essentially a severe, chronic infection that progressively destroys the kidney. We'll explore its causes, how it develops, its symptoms, diagnosis, treatment options, and what the future holds for those affected. So, what causes this destructive kidney disease? While the exact cause of XGP remains somewhat elusive, it's generally accepted that it arises from a combination of factors. The most common culprit is a long-standing bacterial infection, often involving organisms like E. coli or Proteus. But a simple infection isn't enough. There's usually an underlying obstruction in the urinary tract. This obstruction, often caused by kidney stones or, less frequently, tumors or congenital abnormalities, prevents proper drainage and creates a stagnant environment perfect for bacterial growth and inflammation. Impaired immunity and issues with lipid metabolism may also play a role in the disease's development. Now let's break down the pathophysiology of XGP. It's not a simple infection, it's a whole process. The urinary obstruction leads to chronic infection and inflammation within the kidney. This persistent inflammation triggers the infiltration of immune cells, including macrophages. These macrophages attempt to engulf and digest the bacteria and cellular debris. However, due to the chronic nature of the infection and the presence of lipid-rich debris, these macrophages become engorged with lipids, transforming into characteristic xanthoma cells. These xanthoma cells, along with other inflammatory cells, form granulomas, which are masses of inflammatory tissue. Over time, these granulomas replace the normal kidney tissue, leading to its destruction and scarring. This destructive process can extend beyond the kidney, potentially involving surrounding tissues like the perinephric fat and even adjacent organs. XGP is considered a rare disease. Accurate epidemiological data is limited. It's more frequently observed in middle-aged adults, typically between 40 and 60 years old. Women are affected more often than men. There doesn't seem to be a strong geographical predilection, meaning it can occur worldwide. People with diabetes or a history of recurrent urinary tract infections may be at higher risk, though further research is needed to definitively establish risk factors. The signs and symptoms of XGP can be variable and often mimic other kidney diseases, making diagnosis challenging. Many patients experience flank pain, which can be dull or sharp. Fever is a common symptom, indicating an active infection. Patients may also notice blood in their urine, or hematuria. Other symptoms include weight loss, fatigue, and recurrent urinary tract infections. In some cases, XGP can present as a palpable abdominal mass. The non-specific nature of these symptoms emphasizes the need for thorough investigation when kidney problems are suspected. Diagnosing XGP requires a multifaceted approach. A urine culture is typically performed to identify the infecting bacteria. Blood tests can reveal elevated white blood cell counts, indicating infection and inflammation. However, imaging studies are crucial for confirming the diagnosis. Ultrasound can be helpful in visualizing the kidney and detecting any obstruction. Computed tomography, or CT scan, is the gold standard imaging technique for XGP. It can reveal the characteristic features of the disease, including the enlarged kidney, the presence of xanthomatous lesions, and any associated obstruction. In some cases, a biopsy of the kidney tissue may be necessary to confirm the diagnosis and rule out other conditions, such as kidney cancer. XGP can be broadly classified into two main types: diffuse and segmental. Diffuse XGP involves the entire kidney and is the more common form. Segmental XGP, on the other hand, affects only a portion of the kidney. This classification is primarily based on the extent of kidney involvement as seen on imaging studies and has implications for treatment strategies. Treatment for XGP typically involves a combination of antibiotics and surgery. Antibiotics are used to combat the underlying bacterial infection. However, due to the extensive damage to the kidney, antibiotic treatment alone is often insufficient. The most common surgical approach is nephrectomy, or surgical removal of the affected kidney. This is usually necessary to prevent further spread of the infection and to alleviate symptoms. In cases of segmental XGP, a partial nephrectomy, where only the affected portion of the kidney is removed, may be possible, although this is less common. Post-operative care includes monitoring for complications, such as infection or bleeding. Pain management is also an important aspect of post-operative care. Unfortunately, there are no specific preventative measures for XGP due to its complex and multifactorial etiology. However, managing risk factors such as recurrent urinary tract infections and kidney stones may help. Prompt treatment of urinary tract infections and adherence to prescribed medication are crucial. Maintaining adequate hydration can also help prevent kidney stone formation, which is a major risk factor for XGP. Individuals with a history of kidney problems should undergo regular check-ups and imaging studies to detect any abnormalities early. The prognosis for XGP depends on the extent of the disease, the patient's overall health, and the timeliness of diagnosis and treatment. With prompt and appropriate treatment, most patients can achieve a good outcome. However, if left untreated, XGP can lead to serious complications, such as sepsis or spread of the infection to other organs. Recent research efforts are focused on improving diagnostic techniques and developing less invasive treatment options. Studies are also underway to better understand the underlying mechanisms of XGP and to identify potential targets for future therapies. One exciting area of research involves investigating the role of specific immune cells and inflammatory mediators in the development of the disease. By gaining a deeper understanding of these processes, researchers hope to develop more targeted and effective treatments for this challenging condition. Thank you for watching.